Welcome, esteemed viewers, to Daily Health Key 863. I'm Dr. Michael Harris. After years of working with adults over 50, I've witnessed something deeply frustrating. Millions of people are failing to control their blood pressure, not because they are doing lifestyle wrong, but because a seemingly harmless pill in their medicine cabinet is actively sabotaging every single effort. You've cut the salt, you've started walking, yet your BP stays stubbornly at 150/90. I want you to imagine this. While one blood pressure pill is trying to pull that number down, another pill, perhaps the one you take for joint pain allergy, or a sinus headache, is silently pushing it right back up. We must uncover the internal double agent. Dispelling myths. Genetics and the pill trap. 1. The pill trap and the myth of genetics. The warning medication is simply symptom suppression. The truth. Genetics is the potential. Epigenetics, your lifestyle, your diet, your mindset, determines your health outcome. Never believe that high blood pressure is your inevitable destiny. We need to separate crisis from opportunity. Hypertensive crisis, 180 dose 120 mmHg+. This is a medical emergency. You risk physical damage and stroke. Seek immediate medical attention. The golden opportunity, 120 140 mmHg. This is your call to action. It's a clear sign of underlying inflammation and chronic stress. I see patients over-medicated because their blood pressure was measured incorrectly. Accurate measurement tip. Always measure your blood pressure at home, sitting quietly on bare skin after resting for 5 minutes per AHA and CDC standards. The roots of the curse: metabolic breakdown, insulin's vow, the salt-retaining hormone. The core problem: insulin resistance, is the #1 cause of chronic BP. It triggers inflammation, stiffens vessels, and activates the RAAS system, the body's master mechanism for retaining sodium. 2. The worst advice: cut the salt, the broken kidney mechanism. WHO evidence. The theory that salt alone causes high BP fails to account for pressure diuresis, the powerful mechanism where your kidneys naturally dump salt and water when BP rises. When insulin resistance breaks this mechanism, the kidney starts holding sodium regardless of how little you eat. Salt is not the cause. A broken metabolic system is the cause. Diet redesign. Eliminating vascular saboteurs. 3. The myth of dieting: good fat versus bad fat. The strategy. You must eliminate harshly processed vegetable oils and white starches, sugar. Prioritize good fats, EVU and fatty fish. These anti-inflammatory fats are vital for protecting the vascular lining endothelium. Tap Luyen Kang. Luke resistance training. Metabolic action. Resistance training is non-negotiable. It builds muscle, the largest glucose furnace in your body, directly addressing the root cause of insulin resistance. The first call to action. The window of opportunity. If you find this content valuable, please hit the subscribe button now. Share this video with 3 friends who you know are taking pain relievers, cold pills, or chronic steroids. Question the expert. Post your questions about insulin, potassium, or omega-3 ratios in the comments. The best questions submitted via the link in the description will receive a complimentary metabolic health resource kit. The hidden pills, the double agents, the salt retainers, and the decongestant bomb. 4. NSAIDs. Ibuprofen, naproxen, medical warning, NIH. These common pain pills cause significant salt and water retention by disrupting kidney function. Guidance: limit use. Substitute with acetaminophen or natural anti-inflammatories like turmeric, ginger. 5. Cold pills. Pseudoephedrine, urgent warning. These cause acute systemic vasoconstriction, artery tightening. Guidance: avoid formulas with D. Use saline spray or steam inhalation. 6. Steroids. Prednisone. Cortisone mechanism. The most powerful salt retainers. Guidance: if short-term use is necessary, monitor BP closely and aggressively reduce dietary salt during treatment. The neural and hormonal disruptors. 7. Antidepressants, TCA, SNRI, and caffeine, energy drinks. Neural impact. These directly interfere with norepinephrine, causing vasoconstriction and raising heart rate. Action: discuss alternative medications with your doctor that are BP neutral. 8. Limiting caffeine and measurement time. Crucial rule: caffeine causes acute BP spikes. Wait at least 30 minutes after consuming coffee before taking a measurement. 16. Other hidden agents, oral contraceptives, licorice root alcohol hormones, immunosuppressants. Comprehensive warning review. Every item in your cabinet with your doctor, as these all interfere with fluid balance or vascular tone. The vagus switch, permanent reprogramming, the vagus nerve, the ultimate biohack. 9. Neural reprogramming and slow conscious breathing. Philosophy. The breath is the key to interrupting the stress loop and activating the vagus nerve. 10. Box breathing, the military technique. Technique guide through the 4S. Box breathing technique proven to modulate cortisol and stabilize the autonomic nervous system. Mindset, muscle, and micronutrient support. 11. Mindfulness and gratitude practice. Mind-body action. Use gratitude journaling to suppress the amygdala fear center and interrupt chronic stress cycles. 12. Resistance training. Metabolic action, build muscle, the largest glucose sink, which improves insulin sensitivity and requires less medication. Advanced support measurement and the final charge. The measurement of true risk. 13. Measuring metabolic health, insulin CRP and LDL particle count. Precise action, stop focusing solely on total cholesterol. Measure true risk factors like fasting insulin, C-reactive protein inflammation, and LDL-P particle count, as these correlate strongly with BP damage. 14. Potassium, 4,700 mg day, and magnesium glycinate. Electrolyte balance. Kali. WHO recommended to dump excess sodium, magnesium for vascular relaxation and sleep depth. 15. Vitamin K2, vascular integrity, crucial for preventing calcium from depositing and stiffening your arteries. The challenge and the commitment. I want you to imagine this. The state of peace and balance can become your body's default. The final commitment. Commit to the 3-breath rule. 30 seconds to reset your system every time you feel anger or anxiety. Don't strive for perfection. Strive for consistency in your lifestyle redesign. If this video has changed the way you look at your medicine cabinet, please subscribe and turn on notifications now. Share this with anyone taking one of those hidden pills we mentioned. See you in the next video. High blood pressure is not destiny. It is an opportunity to redesign your life.